Of course, with pupils back in the classrooms, attention is very much on how to stop the spread of COVID-19 in schools. High school kids are eligible for the vaccine, 12 years and up. So how's the uptake been? For clarity, I'm joined by the Department of Health Acting DG, Dr. Nicholas Crisp. Dr. Crisp, just a first comment on the numbers. 181 deaths is still a lot of people to lose to COVID-19, even as we are seeing the fourth wave departing somewhat.
Yeah, good evening, Sally, and good evening to the viewers. Thanks very much for the opportunity to speak to you tonight. We have made the point that even though we've got away lightly with Omicron in terms of the total number of people who've required ventilation, the number of people who have been hospitalized and on oxygen has all been far less, but we have made the point that it's still a lethal disease and one has to respect it completely. And that's why we would like everybody to be vaccinated and to continue to take the necessary non-pharmaceutical intervention protections. I think we're going to continue to be vigilant like this for a long time still, so we should get used to it.
Yeah, and of course our kids are back at school. Talk to me about vaccination rates in the 12-year-olds and up. How many kids have been vaccinated in that group?
Yeah, so this isn't an active thing we've been chasing because it's the older people that we really have been, but we crossed the million mark today. So it's 1,029,045 recorded dosages in adolescents between 12 and 17. So it's a good start, but of course that's nowhere near the total. And it's that younger age group, the 12 to 17, but then the 18 up to 39 that are not very well vaccinated, especially in some parts of the country. And they're the people we need to protect.
Yeah, talk to me about what percentage of the population available for vaccines has been. Are we still around 25%, or is it closer to 30 now?
So it depends. We follow different targets. So at the moment, the total number of vaccinations given, and on single-dose vaccines, and I'm looking to see what today's totals are looking like, is quite respectable actually. And we are seeing 45% plus in most parts of the country of people in the older age groups, well, in the total adult population being vaccinated. So at least one vaccine. Individuals vaccinated is 18 million, which is on 45.41%. But then if we're looking at complete vaccination, which is still regarded as one Johnson & Johnson and two Pfizer, then it drops a little bit to 39.91%. But in the older categories, total vaccination in over 60s is just on 60% now. So that's extremely encouraging. And for at least one dose of vaccine, there are parts of the country that have already exceeded 75% vaccinated, which is very pleasing indeed. And the overall total, population coverage in the country in over 60s is already close to 65%.
And that, of course, as you say, is the most dangerous or the most vulnerable cohort of our population. I know that the booster campaign, so the third shots for adults, I think that kicked off earlier this week, didn't it? Tell us how that's going.
Yeah, so the boosters were initiated. First of all, we had the Sosonke 2 study where we were looking at what is the effect of boosting on Johnson & Johnson vaccine. And that was obviously only on healthcare workers. There 235,000 doses have been given, so 235,000 people. We are due to get the figures of boosters by age group and the whole spread across geography and age groups on Friday. So at the moment, I don't know the actual numbers of boosters, of Pfizer and Johnson & Johnson boosters.
How are you going to combat the complacency, which is mixed in with hesitancy and downright aversion to vaccines, which I think is increasing the complacency, bearing in mind that we know that Omicron, it seems, is actually somewhat less serious, a variant. How are you planning to communicate to people that they should still come for their jabs, come for their boosters?
Well, sadly, there are a lot of things that are going on, and I think I've once before said that there are two parts to the strategy. There are obviously lots of interventions in each of them. The one part is making sure that we don't put obstacles in people's place to come and get vaccinated. So we need to take the vaccination service closer and closer and closer to people's homes. On the other side, we need to make sure that people, even when we get to their homes, or if they do have the means to travel to a vaccination site, that they understand the facts and they know and they want to be vaccinated. And that's a communication difficulty that not all of us in the health sector fully understand. So we bring communicators online to help us. So there are a number of incentives, there are a number of disincentives. We've been watching what's going on around the world. There's still a very topical discussion going on in NEDLANC and other forums around mandating for vaccinations as one means of doing this. We hear other countries doing things like adjusted tax levels for the unvaccinated. So this is a very complicated area. We have said before in government that we want to be very careful about rushing into it. And we are meeting tomorrow as a senior management team together with the minister and the MECs of the provinces and a number of other specialists to take stock of exactly where we are and to look at what we do about demand creation going forward.
I want to talk to you about the fact that our government schools, most of them, are still on a rotational system. And parents are feeling, in many cases, that their children are still missing out. It is not an ideal situation to have a sort of a one day on, one day off system for our kids in most of our schools. And one of the biggest issues is ventilation and making sure that people and pupils are not sitting close to each other. In under-resourced schools, it's just not possible. We've seen the Department of Education sort of bringing in mobile classrooms and trying to do what they can. But do you think that we need to, is it safe, I suppose, to maybe move away from rotational classrooms and classes and just bring everybody back?
Yeah, Sally, there's been a number of meetings this week. I mean, we're all mostly back at work this week. Some of us were back last week, but the majority of people are back this week. So I wasn't in all the meetings. I've been in one particular meeting during the course of today, taking stock of where we are for the year and so forth. And that's taken me away from the meeting with the Department of Basic Education. So I'm not, and I've just walked out directly from that meeting to this interview. So I haven't caught up with the colleagues who met with the Department of Basic Education this morning. But I think it's not just about basic education or high school education. It is about workplaces. It's about us all feeling that we're safe going into an environment. And if, for example, we were talking about call centers where people go to work, they sit at the call center at the station, but they are in a bubble, if you like, with perspex around them. Now, not everybody is able to do that perspexing to isolate each individual, but there are methods that people can do by facing desks away from one another and so forth. The same would go in office spaces. So what you do want to achieve is a reasonable distance, keeping the windows open. The weather at the moment is generally pretty good, and in most places, if you're in an indoor facility, you can keep the doors open or work in a wider space, have some classes in halls if there are halls available. So I think we will be making more detailed recommendations once we're through with listening to everybody's suggestions yesterday, today, and tomorrow, and start putting it all together by Friday and the weekend. It's not just the health department that influences these things. It's not just our advisors. As you quite rightly said, there are economic and societal issues. But I think we're all ready now to move away from what we've been dealing with. So while we remain cautious, we remain very alert about another variant, and we watch what goes on with the positive tests around the country. I think it is time that we start moving into more of an endemic mode, and that is the general mood amongst the colleagues that I work with.
Well, that's certainly encouraging to hear, and we await more details as you continue your meetings. Thank you so much for chatting to us this evening. That's the Department of Health Deputy Director General, Dr. Nicholas Crisp.